Hello there, my name is Silvana, and I'm just going to talk about the procedures before I start the ECG with the patient. Of course, I'll get the patient in, introduce myself, ask patient name and date of birth, make sure the patient understands what the ECG is, and ask for consent. Once the patient is happy to proceed with the ECG, ask the patient to just be nice and relaxed, lie in bed. Make sure the bed is in a position that the patient can be comfortable. Patient to have an ECG gonna have to have the top off, and sometimes female patient gonna have to take the bra off as well. I normally can do the ECG without taking the bra off. Depends on the size of the bra and the patient as well. The main thing to get a good ECG is making sure patients know doesn't hurt, know they need to be comfortable, get the bed in a position that the patient can actually relax, and doing all these steps should be able to get a good ECG.
So my name's Poppy, I'm one of the Chief Cardiac Physiologists here in the Cardiorespiratory Department.
My name is Silvana, I'm a cardiographer. I'm going to be here helping Poppy to show you how to do a good ECG.
So today we're going to show you firstly how to record a good quality ECG, and then we're going to cover some common problems that you may incur on the wards and things like that, and provide you with some tips and tricks on how to overcome these.
Good.
Our lovely model today is Stefan. He is one of the porters around the hospital, so you probably do recognise him. So thank you very much.
Thank you.
Nice.
The information that is used within this video is based on the SCST guidelines for recording a 12-lead ECG and our own experience, you know, on the tips and tricks and things on how to overcome the troubleshooting. All right. Firstly, we must stress the importance of getting the electrode positioning on the ECG correct. If we don't get the electrode positioning on the ECG correct, it can result in the ECG being misinterpreted and the patient receiving incorrect diagnosis or treatment. Number one thing to remember when trying to record a good quality ECG is about the patient positioning. So ideally what we want is all four limbs supported on the bed, and the back of the bed to be at a 45-degree angle. So ideally what we want is arms down onto the bed.
Yep.
We want shoulders dropped, so nice and relaxed, and we want the feet
to drop.
Dropped and rolled out to the sides, and so ensuring they're all supported and all relaxed. What we're aiming for with the ECG is for a nice clear trace, and then what we mean by that is no thick baselines and all of the traces to be nice and straight across the page. By doing this, that should help to avoid that from happening. We appreciate that in some patients and some environments this may not be achievable, but we will cover some tips and tricks on how to overcome this later on in the video. So the next thing we're going to move on to is skin preparation. So skin preparation is often required to help produce an artefact ECG. Care must be taken with patients who have sensitive or broken skin. However, some ways to help minimise the artefact from skin is shaving the chest, so to remove the hair. It's about lightly abrasing the skin, so we can do that with either an alcohol wipe, a paper towel or a gauze, or we have some abrasive tape down here in our department, which is just like a little bit of sandpaper as such, so it helps to abrase the skin, just to get rid of them dead skin cells. So Savannah's just skin prepping the areas here for where we're going to place the electrodes. And we will go to electrode positioning after this. If you have patients with creams and things on, you might want to use an alcohol wipe just to try and get through that grease, or just use some soap and water just to give the skin a clean. It's important to have a nice dry skin as well, so if you've got like a sweaty patient, or if you use the paper towel and the water, just make sure you give that a really good dry off as well, otherwise the electrodes won't stick very well. So first of all, we're going to locate where to pop the limb leads. So we've got our patient nice and relaxed, we've prepared the skin, so now we're going to pop the electrodes on the limbs. So the limb leads should be placed proximal to the wrists and ankles wherever possible. If this is not possible, the limb leads can be moved up towards the torso, but this should be documented on the ECG. So you can see that Silvana's just popping these just on the inside of the wrists. And a little tip for this will be, if you have the tab facing outwards, then when they turn their arms back over to relax, it makes the electrode stay on a lot easier. She's just going to do the same with the ankles, so just on the inside of the ankles. Again, tabs facing outwards. Lovely. So next we're going to move on to trying to find the electrode positionings for the chest. So the anatomical positions for the chest electrodes are defined as the 4th intercostal space on the right sternal edge for V1. V2 is the 4th intercostal space at the left sternal edge. V3 is midway between V2 and V4. V4 is the 5th intercostal space in the mid-clavicular line. V5 is the left anterior axillary line at the same level as V4, and V5 is the left mid-axillary line at the same level as V4 and V5. Silvana's going to show you 2 ways how to identify the electrode positioning. The first way is counting down from the clavicle. So we don't count the top space, as that's not an intercostal space.
That's 1.
Yep.
2.
Yep.
3.
4. So from counting down from the clavicle, we actually have to count down 5, because you have to count this top space here. So as Silvana did, she counted the 4 intercostal spaces. She now needs to come into the right sternal edge, and this will be the location for V1. Lovely. With the chest electrodes, it's easier if you pop with the tab facing down, as then all the leads will sit nicely on the patient's chest. V2, we have to count down from the other side again. Again, finding the 4th intercostal space and popping it on the left sternal edge. The second way that we can identify where these positions are is by using what we call the angle of Louis. In order to do that, you run your hand down the centre of the sternum and you find the horizontal ridge, and you should go into the intercostal space number 2. And then you will just need to count down 2 from there, and that will be into the 4th intercostal space, as we identified from counting down from the clavicle as well. So Silvana will just do that again. There's the ridge into intercostal space 2, 3, 4, and where we need to go onto the sternal edge. So this is your V1 and your V2 positioning. We're going to miss V3 because we need to put V4 on before we can put V3 on. So V4 is the 5th intercostal space at the mid-clavicular line. So we're going to count from here, and we're going to count 1 more intercostal space, and we're going to come midway from the clavicle. So this is the clavicle, so we're going to come straight down here and pop that there. And then V3 we can go back to, and that is midway between V2 and V4. Lovely. So we're now going to do V5. So V5 is the left anterior axillary line at the horizontal level as V4. So commonly, it's normally from the crease of the armpit, where Silvana was just going. We come straight down. We don't follow the intercostal space, so we don't do any more feeling now. We just follow the line from V4 horizontally across, in line, usually with the armpit line. And just as a side note, it's very, very common. V4 is often placed under the nipple. That is not anatomically correct. We do not follow the nipple. We follow the mid-clavicular line and come midway through it. All right. V6 is the left mid-axillary line at the same horizontal level as V4 and V5. Commonly, it's again in the straight line from V4, but more on the side of the torso. So we have this one at the mid-clavicular line, we have this one normally in line with the armpit crease just here. And then this one is more round on the side of the torso, okay? But all in a straight line from there. And you should see a gap between this level here and this level here because you're in a different intercostal space. If we have a female patient, most of the time V4 and V6 will be located underneath the breast tissue. So what we want to do with that is we want to use our hand or our elbow and just gently lift up the breast tissue, and most of the time these will be located right in the crease underneath the breast, okay? So we need to make sure also with our skin preparation that we've got really nice and dry and a good contact with the skin underneath that area, all right? So we've got all of our electrodes on to the patient, so now it's time to attach the leads to the electrodes. It's a good idea to try and get your leads all sorted out into this sort of formation here, as it will make it easier to attach and have less tangles and muddling around when you're trying to do it. So Silvana's got the limb leads there for the right side of the patient. We attach them onto the top of the tabs. And as you'll see what I said earlier about having the tabs facing you and facing away from you, it just means that the electrodes now will sit nice and straight on the patient and not be pulling off from going the other way. They should all be colour coded and have them written on the leads themselves what electrode they correspond with, or if not, they are also written along here. There probably are different variations of this ECG machine within the hospital, so this is just for this one machine that we've got here. And again, we're trying to attach the wires to the electrodes in a nice untangled way, keeping all of the wires facing down. If for whatever reason you do see an electrode being pulled around a little bit, there is a little tip here, so you can twist the wire at the bottom and it will help to keep it on there a little bit better, so it's not being pulled on like that. So you can just twist this bottom bit here and it helps to keep it on a little bit better. So we're all attached, so we're just going to check that we've got all of the electrodes in the right positioning. So we're happy with our electrode positioning. We're happy that we've got our wires all in the right way. So we've got 1, 2, 3, 4, 5, 6. We've got the yellow and the green on the left side of the patient, and we've got the red and the black on the right side of the patient. The next thing we need to do now is just relax our patient again so we can get that nice clear trace, all right? So again, we want arms down by the side.
Relax your head for me.
And we ideally want the palms turned back over like that so that the hands can be nice and relaxed. Feet, again, we want rolled out to the side, nice and floppy, and then the shoulders just relaxed as well. So Silvana's going to go and obtain a printout of the ECG. So what you want to do is you want to watch the ECG go across the screen and just make sure that all of the lines are nice and straight, there's no thick baseline, and that you haven't got any baseline wander so that the wires are wobbling all over the screen. If you see any of that, just recheck your patient, make sure they're nice and relaxed. And sometimes when you print the ECG out, it does actually look better than what it does on the little screen, so it's always worth just printing it out and just seeing if you're happy with it. So we've printed out the ECG. So this is the type of quality that you're going to be looking for with the ECG. You want nice straight lines, a nice thin baseline, no wandering all over the page. We can see each of the complexes, so the P and the QRS and the T wave. So yeah, this is ideally the standard of ECG that you want to be aiming for. This ECG here, we can see that the patient has a lot of muscle tremor, okay? So they're very tense in their arms and legs. We've got the thick baseline and we've got the muscle tremor in the limb leads. We can still see some of the chest leads, however it's still got that muscle tremor in it, okay? And it does distort some of the complexes. So ideally we want to try and get the patient relaxed with this one, re-relax their arms, shoulders and legs, and then retake another one. So the patient artifact ECG will also look very similar to if you have electrical interference, particularly in the chest leads. If you've got electrical interference, there will be a thick baseline, making the ECG difficult to interpret. Common things that will cause the electrical interference on the wards around the hospital, any electric beds and machines around the patient. What you want to do is you always want to turn the bed off, and obviously you want to turn off any machines that you can. We do appreciate that not all machines can be turned off, but you just want to try and turn off as many as you can. This ECG here, what we've got on this one is baseline wander, so this would be patient movement. So again, we want the patients to try and stay as still as we can, which we know is difficult, but in order to do that we just want to relax them, keep them nice and still and comfortable, and then we'll get a nice clear ECG like the first one we showed you.
So now we're just going to talk about some of the problems that I encountered around the wards and the hospital when it comes to this machine. This is the ECG machine we have all around the hospital. Here, if you look here, it's saying 1, and that's the battery. 1 is these little leads, portable leads here. Saying here, searching for the 1 is because it's not on. So you need to make sure when you're doing ECG, you put that on. Right now, many people as well, when I went to the wards, they wasn't aware that the 1 has their own battery, so don't charge with the machine. So if the battery is always shown here, that needs to be changed. That is what you do. You just open there. It's a double A. There you go. So it's connected. Saying leads off because it's not connected to a patient yet. So now I'm just going to show you how to change the paper. Okay? On the side here you have a little drawer. Just press it down, pull it. You need to make sure that this white part of the paper is facing you. So in, and make sure you pull a page out, close. We can do a little trial, just do a reading. Paper is in properly. You press stop. And the machine is ready to be used. When doing ECGs, we have problems before if wards come and they couldn't get the ECG. And one of the main issues is that the little electrodes are dry. So make sure when you use them, have a look, have a little feel. You can feel that there's still gel there, look. Make sure that is in date, and make sure after using the electrodes, make sure you close the pack and protect it, okay?
So one more thing to troubleshoot will be the paediatric patients. So sometimes it's not possible to put the limb leads on the standard position on the wrists and the ankles because there will be too much muscle tremor or movement. So what we can do with that is we can move the electrodes up onto the torso. However, this is not recommended in everyday practice, only in the situations where you can't get an ECG. It must be documented on the ECG, written on the top of the page, to say that we've altered the positioning. We also have the paediatric patients these little baby ECGs electrodes. So what you need to do with these is take off the top clip of the wires, and they should all come off. I'll just show you a few. They should all come off like that. Keep these somewhere safe because obviously you're going to need to pop these back on. And all we do is we reconnect them to the ends of these electrodes that are already attached onto the stickers, alright? So we end up attaching them like that. These are really nice and soft, okay, and really quite gel as well. They're not very sticky in terms of getting stuck to the skin. So they do go on very nicely with the baby patients. And a nice way to take them off is they do just sort of peel off a bit like glue, alright? So you can just sort of slowly peel them off rather than ripping them off as well.